Hello and welcome. Today we're diving into a relatively uncommon but serious eye disease, syphilitic optic neuropathy. This condition, caused by syphilis, can lead to significant vision loss if left untreated. Join us as we explore its cause, effects, diagnosis, and treatment. Syphilitic optic neuropathy, as the name suggests, is a complication of syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum. The infection typically begins with a painless sore, or chancre, but if untreated, it can progress through various stages, ultimately affecting multiple organ systems, including the eyes and the nervous system. Neurosyphilis, the involvement of the nervous system, is the key precursor to syphilitic optic neuropathy. So, how does syphilis damage the optic nerve? The exact mechanisms are complex and not fully understood, but it's believed that Treponema pallidum can directly invade the optic nerve, causing inflammation and damage. Additionally, the body's immune response to the infection can also contribute to nerve damage. This inflammation disrupts the normal functioning of the optic nerve, which is responsible for transmitting visual information from the eye to the brain. The result is impaired vision. Syphilitic optic neuropathy is not a common condition, but its incidence is linked to the prevalence of syphilis. Certain populations, particularly those with HIV infection or those engaging in high-risk sexual behaviors, are at increased risk. It's crucial to remember that accurate data on the exact prevalence can be challenging to obtain because syphilis itself can go undiagnosed for extended periods. The signs and symptoms of syphilitic optic neuropathy can vary, but they often include painless vision loss in one or both eyes. This vision loss can range from mild blurring to severe impairment. Other symptoms may include changes in color vision, visual field defects such as blind spots, and pain with eye movement. Some patients may also experience other neurological symptoms associated with neurosyphilis, such as headaches, stiff neck, or changes in mental status. Diagnosing syphilitic optic neuropathy requires a thorough evaluation, including a detailed medical history, a complete eye examination, and neurological assessment. Blood tests are essential to confirm the presence of syphilis. These tests include both non-treponemal tests, like the RPR-VDRAO, and treponemal tests, such as the FDA-ABS or TPP. Cerebrospinal fluid analysis, obtained through a lumbar puncture, is often performed to assess for neurosyphilis and rule out other causes of optic nerve damage. Imaging studies, such as MRI of the brain and orbits, may also be used to evaluate the optic nerve and surrounding structures. While syphilitic optic neuropathy doesn't have distinct types in the traditional sense, the presentation can vary. Some patients experience acute, rapid vision loss, while others have a more gradual and insidious onset. The severity of vision loss and the presence of other neurological symptoms can also differ from person to person. The primary treatment for syphilitic optic neuropathy is intravenous penicillin. High doses of penicillin are administered over a period of 10 to 14 days to eradicate the Treponema pallidum bacteria. Corticosteroids are sometimes used in conjunction with antibiotics to reduce inflammation and potentially improve visual outcomes, although their role remains controversial. Regular follow-up appointments with an ophthalmologist and infectious disease specialist are crucial to monitor treatment response and detect any complications. The best way to prevent syphilitic optic neuropathy is to prevent syphilis infection in the first place. This involves practicing safe sex, including using condoms consistently and correctly, and getting tested regularly for sexually transmitted infections, especially if you are at increased risk. Early detection and treatment of syphilis are essential to prevent the development of neurosyphilis and its complications, including syphilitic optic neuropathy. The prognosis for syphilitic optic neuropathy depends on several factors, including the severity of vision loss at presentation, the promptness of diagnosis and treatment, and the overall health of the individual. Early treatment with penicillin can often halt the progression of vision loss and, in some cases, even lead to some visual recovery. However, significant and permanent vision loss can occur if treatment is delayed. Research continues to explore novel therapeutic strategies and improve diagnostic methods for neurosyphilis and its ocular manifestations. Recent studies are focusing on optimizing antibiotic regimens and identifying biomarkers that can predict treatment response and visual outcomes. Thank you for watching.